Application of theory, Mr. Maldonado. Clarissa Gonzalez, Melissa Martinez, and Alfonso Jimenez. Social Work 7338, Theories and Perspectives, Hispanic Children and Families, Professor Dr. Joy Patton, November 27, 2025. Concerns and needs identified through an assessment process. From a social work perspective, the most important concerns and needs for a client grieving the loss of a child or loved one include the severity of depression and grief symptoms, the presence of other risk factors like substance use or suicidal ideation, and an assessment of their practical and emotional support systems. Social workers must address the client's physical health, sleep, and daily functions while also identifying their need for a safe space to express emotions and connect with community resources like support groups. Concerns: grief related major depression. There have been numerous longitudinal follow up studies of the newly bereaved. The majority of studies have focused on the widowed, although there are excellent studies of children who have lost a parent and of parents who have lost a child. Most studies have found roughly similar results, demonstrating a high frequency of depressive symptoms that diminish in frequency and intensity over time, but that may continue to occur at greater frequency than in non bereaved controls for years after the death. Concerns: grief and substance abuse. Renzoni stated that grief can be an unspoken bond between people who are in treatment for substance use disorders. People have often suffered many losses by the time they enter recovery. Drug and alcohol addictions can devastate relationships, careers, and even a person's sense of identity. Losing a loved one compounds these other losses, especially when substance use delays the expression of grief. Some people start using substances for the first time to cope with the loss. Other people suffer losses in the course of addiction. Emotional numbing and other effects of substances can block the grief process and prevent people from resolving a loss. Unresolved grief can develop into complicated grief disorder, a psychological condition with many risks. Concerns: grief and suicidal thoughts. Losing someone you love can be one of the most painful experiences in life. Grief touches every part of you emotionally, mentally, physically, and sometimes it can feel overwhelming. Some people find themselves struggling with dark thoughts, including thoughts of suicide. Grief can take many forms. For instance, it brings sadness, tears, or numbness. For others, it brings guilt, anger, or even relief, especially after a long illness. When grief feels too heavy, it can blur the line between wanting a relief from the pain and feeling like life is no longer worth living. Suicidal thoughts during grief are more common than many realize. You may feel isolated even if others are around you. Some people believe they must be strong for others and suffer in silence, but bottling up this pain only deepens it. Talking about your thoughts and feelings is not a sign of weakness. Sharing your feelings can bring much needed relief. Needs: emotional support, which provides a space for the client to process their feelings and offer a non judgmental presence. Resource connection: link the client to support groups, counseling services, and community resources. Coping skill development: help the client develop or optimize new coping strategies such as mindfulness or cognitive reframing. Practical assistance: assist with practical needs like help with daily responsibilities, connecting with financial or legal aid, or managing other health issues. Integration of loss: support the client in finding meaning in the loss and integrating it into their life, allowing them to find a new sense of self.
Hello, this is AJ providing two interventions, one for CBT and the other for family systems theory. A suitable CBT intervention for Mr. Maldonado is cognitive restructuring. It involves the goal and process of an intervention aimed at replacing dysfunctional thoughts with more adaptive ones. The main methods to support this cognitive change are verbal intervention strategies. This approach is used to identify, challenge, and alter unhelpful or distorted thoughts that contribute to emotional distress, which is especially relevant given his recent loss and descriptions of life as unbearable and foggy. So, how does cognitive restructuring address Mr. Maldonado's needs? This intervention helps individuals modify negative thinking patterns that often arise after a significant trauma or loss. Mr. Maldonado is seeking over time to avoid going home and uses language indicative of profound, potentially distorted grief. Life is unbearable. Um, the cognitive restructuring can help him process these feelings more healthily. The intervention steps, the social worker would guide Mr. Maldonado through the following steps. Identify automatic negative thoughts. The social worker would assist Mr. Maldonado in recognizing specific thoughts that occur when he is not working or when he thinks about going home. Examples of potential automatic thoughts might be something like, I can handle being at home without my son. My life is over now. If I keep busy, I won't feel this pain. Continuation of the intervention steps. The social worker would encourage Mr. Maldonado to reflect on his beliefs, guiding him to weigh the evidence for and against them. For example, while he feels that my life is over now, he is reminded of his supportive daughter, his faith in the community, fulfillment career, and resilience after losing his wife. His despair is the only evidence for that thought. The process helps him consider if holding these thoughts truly benefits him or if they worsen his suffering. Another step is to develop balanced, realistic thoughts. Finally, Mr. Maldonado would work on creating alternative, more balanced perspectives. These might include, my son's death is a profound loss, but I still have a life to live and a supportive daughter who needs me. Avoiding my home just postpones the grief. Confronting my feelings will help me heal. So, by utilizing cognitive restructuring, the intervention aims to alleviate the intensity of his emotional pain, reduce avoidance behaviors, and facilitate the grieving process, ultimately improving his quality of life. An intervention for family systems theory is structural family therapy, which helps understand and treat family behavioral issues by focusing on interaction patterns and family roles, using action techniques to promote change. It explains problems through relational networks rather than individual psychodynamics. This approach is relevant for Mr. Maldonado, given his close relationship with his daughter and cultural emphasis on family support. His son's death likely disrupted family roles and communication, causing distress and avoiding behaviors. Some key applications for Mr. Maldonado's case. Boundary restructuring. The therapist would work with Mr. Maldonado and his daughter to establish healthy boundaries. After his wife's death, Mr. Maldonado became the sole provider and caregiver, possibly forming a close relationship with his children. Now, with grown children and his son deceased, restructuring is needed. The goal is to set boundaries that support his daughter's independence and mutual support, providing him from relying on her to feel his son's absence or grief. Key applications continued. Another application is the strengthening the spousal subsystem post hoc. While his wife has passed, the intervention can focus on his role as a widower. His overworking indicates avoidance of his loss at home. A structural therapist would help him confront this within the family, encourage him to seek emotional support from his daughter instead of work. Another application is challenging family interactions, where the therapist would engage in family sessions to observe and modify dysfunctional patterns like Mr. Maldonado's emotional cutoff of avoiding home. This provides immediate feedback and helps practice new communication styles that foster open grieving and support. And the last key application is for cultural consideration. The therapist would incorporate his Hispanic background by emphasizing family unity and mourning rituals. like a 9-day rosary. These serve as powerful tools in therapy to aid acceptance and normalize while respecting cultural values. By addressing the family system's structural problems and leveraging its strengths, structural family therapy helps Mr. Maldonado and his daughter navigate this profound loss in a healthy and supportive manner.